Infectious diseases in dogs are a major concern due to their highly contagious nature. These diseases spread rapidly from one dog to another, especially in environments where multiple dogs are housed or interact closely, such as shelters, kennels, dog parks, and grooming centers. Transmission occurs through various means, including direct contact with an infected dog, contact with contaminated surfaces like food bowls, bedding, and toys, or through the air when an infected dog sneezes or coughs. Some viruses, such as canine parvovirus, are particularly resilient and can survive in the environment for long periods, making it easier for healthy dogs to come into contact with the virus even without direct exposure to a sick animal. Diseases like kennel cough, canine distemper, and canine influenza are easily passed through airborne droplets. A simple bark, sneeze, or cough from an infected dog can send microscopic pathogens into the air, which are then inhaled by nearby dogs. In the case of parvovirus, the virus is shed in large amounts in the feces of infected dogs, and even trace amounts on shoes, hands, or paws can be enough to infect a healthy dog. This ease of transmission is why outbreaks can occur so quickly in communal settings. Moreover, puppies and unvaccinated dogs are at a higher risk because their immune systems are not fully developed or protected. The severity of symptoms can range from mild to life-threatening, and the speed at which some infections progress means that delays in diagnosis or treatment can lead to severe outcomes, including death. Therefore, it is essential for dog owners to be aware of how easily these diseases spread and to take proactive steps in prevention through vaccinations, proper hygiene, isolation of sick dogs, and regular veterinary care to protect their pets and others from these highly contagious illnesses. Vaccination plays a vital role in protecting dogs from a range of infectious diseases that can be severe or even fatal. Puppies are especially vulnerable in their early weeks of life, as their immune systems are still developing and they may not yet have received full protection through vaccines. Core vaccinations are recommended for all dogs and include protection against diseases such as rabies, canine distemper, parvovirus, and canine adenovirus. These diseases are not only highly contagious, but can also progress rapidly, making early immunization critical for survival and long-term health. Vaccines work by stimulating the dog's immune system to recognize and fight specific pathogens without causing the disease itself. This creates a memory in the immune system so that if the dog is later exposed to the actual virus or bacteria, it can mount a rapid and effective defense. Regular booster shots are also essential, as immunity can wane over time. Veterinarians typically follow a vaccination schedule that begins when a puppy is about 6 to 8 weeks old, with additional doses given every few weeks until around 16 weeks of age. After the initial series, dogs require periodic boosters throughout their lives. In addition to core vaccines, there are non-core vaccines that may be recommended based on the dog's lifestyle and environment. These include vaccines for kennel cough, Lyme disease, and Leptospirosis, which are more common in certain regions or among dogs that frequently interact with other animals. By staying up to date with both core and non-core vaccines, dog owners not only protect their own pets, but also contribute to the broader goal of community health. Vaccination reduces the overall number of susceptible animals in a population, which helps prevent outbreaks and controls the spread of infectious diseases within the dog community. Some infectious diseases in dogs pose not only a threat to the animal, but also to humans, making them zoonotic in nature. Zoonotic diseases are those that can be transmitted between animals and people, either directly through contact or indirectly through contaminated environments. Rabies is one of the most well-known zoonotic diseases and is almost always fatal once symptoms appear. It can be transmitted through the bite or saliva of an infected animal, and because of its seriousness, both animals and humans are advised to be vaccinated if there's any risk of exposure. This is why rabies vaccination is mandatory in many regions for pets. Leptospirosis is another significant zoonotic disease affecting dogs and humans alike. It is caused by bacteria found in water contaminated with urine from infected animals, including rodents and other wildlife. Dogs can contract it by drinking or swimming in contaminated water, and humans can become infected in similar ways or through handling an infected dog. Leptospirosis can lead to serious liver and kidney damage in both species, making awareness and prevention extremely important. Other less severe but still concerning zoonotic infections include ringworm, a fungal disease that affects the skin, and certain gastrointestinal parasites like roundworms and hookworms, which can be passed through dog feces. These parasites can pose a higher risk to children, the elderly, and individuals with weakened immune systems who are more likely to come into close contact with pets. Practicing good hygiene, such as regular hand washing after handling pets or cleaning up after them, along with routine deworming and vaccination, greatly reduces the risk of zoonotic transmission. Dog owners should work closely with veterinarians to monitor for any signs of illness that could be contagious and take appropriate precautions to keep both their pets and their families safe. Dogs that frequently spend time in communal environments, such as shelters, boarding kennels, doggy daycare centers, dog parks, training classes, and grooming salons are at a significantly higher risk of contracting infectious diseases. These settings often involve close contact among many animals, creating an ideal environment for the rapid transmission of viruses, bacteria, and parasites. Even with cleaning protocols in place, the sheer volume of dogs and shared surfaces makes complete sanitation challenging, which increases the risk of exposure to pathogens. In many of these places, dogs may come into contact with food and water bowls, toys, bedding, and surfaces that may have been contaminated by an infected dog. Respiratory infections, such as kennel cough and canine influenza, are particularly common in these environments. They spread through airborne droplets when a dog coughs or sneezes, or by direct nose-to-nose contact. A single infected dog can transmit the illness to many others within a short time. Similarly, gastrointestinal viruses like Parvovirus can linger in the environment for weeks or even months and are highly resistant to many disinfectants. This makes it easy for a healthy dog to contract the disease simply by stepping on contaminated ground or licking a soiled object. Additionally, stress levels in communal environments can be high, especially in shelters or boarding facilities. Stress weakens a dog's immune system, making them more vulnerable to infections they might otherwise resist. Younger puppies, older dogs, and those with compromised immune systems are even more susceptible in these situations. For this reason, it is essential for dog owners to ensure their pets are fully vaccinated and in good health before entering communal spaces. It is also wise to observe hygiene protocols, such as avoiding shared water bowls and using personal equipment like leashes and food containers whenever possible to minimize risk of exposure. Recognizing early symptoms of infectious diseases in dogs is crucial for ensuring timely treatment and preventing the spread of illness to other animals or even humans. Many infectious diseases begin with subtle signs that may easily be overlooked by pet owners, especially if they are not familiar with what to watch for. Common early symptoms include lethargy, loss of appetite, mild coughing, sneezing, watery eyes, vomiting, or diarrhea. These signs might seem minor at first, but can quickly escalate if the underlying cause is a serious infection, such as Parvovirus, Distemper, or Leptospirosis. Dogs that usually have high energy levels may suddenly become tired and uninterested in playing or walking. A decrease in appetite or refusal to eat, even for a single day, can signal that something is wrong internally. Respiratory symptoms like sneezing, nasal discharge, or a persistent cough could indicate illnesses such as kennel cough or canine influenza. Vomiting and diarrhea, especially if accompanied by blood or a foul odor, are red flags for gastrointestinal infections like parvovirus or coronavirus. Even changes in behavior, such as hiding, whimpering, or increased irritability, can be indicators of discomfort or fever. Early detection greatly improves the chances of successful treatment. For instance, diseases like parvo can be fatal within days if untreated, but survival rates improve significantly with immediate veterinary intervention. Furthermore, identifying symptoms early allows for isolation of the sick dog, which helps protect other pets from becoming infected. It also minimizes the risk of zoonotic disease transmission in cases such as leptospirosis or ringworm. Pet owners should be observant of any changes in their dog's routine, behavior, or physical condition and consult a veterinarian promptly when something seems off, as early action can make all the difference in recovery and disease control. Preventing infectious diseases in dogs is far more effective and less costly than treating them after they occur. Prevention involves a combination of proper vaccination, routine veterinary care, good hygiene practices, and responsible pet management. Vaccination is the foundation of disease prevention, protecting dogs from some of the most dangerous and contagious illnesses like rabies, parvovirus, distemper, and hepatitis. Following the recommended vaccination schedule and getting timely boosters ensures a dog's immune system is prepared to fight off infections. Regular veterinary checkups are essential for early detection of any health issues. Vets can identify symptoms that may not be obvious to pet owners and recommend appropriate actions to maintain health and immunity. Annual wellness exams, along with fecal tests and blood work, help catch infections or internal parasites early before they become serious. These visits also offer opportunities to discuss region-specific vaccines or preventatives based on the dog's lifestyle and environment. Maintaining a clean environment at home and in public places plays a big role in reducing exposure to infectious agents. Regularly disinfecting food and water bowls, washing bedding, and keeping living areas clean can limit the spread of harmful bacteria and viruses. It's also important to prevent dogs from drinking from puddles or stagnant water, which can carry leptospirosis or other pathogens. Responsible pet ownership includes keeping sick dogs isolated from others, avoiding crowded dog parks if vaccinations are not up to date, and ensuring puppies are properly vaccinated before socializing. Deworming, flea, and tick prevention also play crucial roles in protecting against parasitic infections that can weaken the immune system and make dogs more susceptible to secondary infections. Together, these preventive measures form a strong defense against infectious diseases and help ensure a long, healthy life for every dog.